Good afternoon, everyone, and thank you for joining us for today's webinar titled Beyond the Patient Portal, Technology for Improved Consumer Engagement. We'll be doing today's webinar with Brian Eastwood, who is our engagement analyst over here at Chilmark Research. This is a rather excellent report, probably one of the better ones published about the patient engagement space and kind of what we need to do as an industry and as a large market vertical to really drive patient engagement going forward, and how we need to be rethinking traditional methods of engagement that we have been employing for the last decade plus. A little bit about us. Chilmark Research is a market analyst firm. We have focused exclusively on the healthcare IT industry since our founding. And we run the business around a few core beliefs that we hold here. We are definitely a mission-driven organization on helping to improve patient outcomes and the patient experience of care. And we believe this can be most effectively done through the deployment and use of effective health IT that will contribute to the improving of delivery of care and ultimately the patient experience. We focus exclusively on those technologies that we believe will be transformational to healthcare delivery. So these are technologies that have been pushing the boundaries of how care is delivered. And you can find out what domains and what types of technologies we cover on our website, but we try to shy away from things that are more administrative and kind of rudimentary to the functioning of a hospital and focus more on the actual technologies that are changing the way that care is delivered. And we strive to provide comprehensive, objective, high-quality research to create a more informed market on the effective adoption and use of IT. And we do this through our blog, which many of you already signed up for, and if you haven't, we would definitely recommend it. It's our way of sharing free insights with the industry. And then also through our reports that we sell on the website, as well as our Chilmark Advisory Service, which is a separate product that gives full access to all of our content to clients, as well as access to our analysts. All right, without further ado, I would like to let Brian take over this. But before he does, I just want to make one quick suggestion. If you have questions to ask that pop up throughout the conversation, throughout the webinar, please feel free to send them to me in the chat box at the bottom of the GoToWebinar panel. I will see those, and I will make sure that Brian gets asked those questions at some point during the webinar. All right. Brian, take it away.
Thanks, John. Good afternoon, good morning, or good evening, depending on where you're listening to us from. So over the course of the next 20 or so minutes, I'm going to sort of take a look at why healthcare organizations are in a position to replace the patient portals they have in place, outline the broader, more coordinated engagement model that Chilmark has outlined in this report, look at who will be the stakeholders toward driving innovation in providing next-generation engagement solutions, talk a little bit about the market outlook for the next few years, and then offer some conclusions and recommendations for healthcare providers as well as healthcare IT vendors. And then, as John noted, I will leave some time to answer some questions at the end of the webinar, as I'm sure you guys will have some. So I wanted to start by just looking at sort of the typical engagement model for healthcare organizations, and really it's sort of implement a portal and then just set it and forget it. Hit the bare minimum metrics that either federal regulations or your own internal development teams have put in place, and then move on to the next project. It's really, it's just kind of a one and done sort of IT implementation project, which works for most types of IT systems, but not necessarily for patient portals. And the reason for that is because most portals are not really optimized for the type of care that healthcare organizations want to provide. They're typically systems of record. They capture information about individual episodes of care as opposed to the broader care needs of a consumer. And in this report, I use the term consumer as opposed to patient in order to reflect that the vast majority of the time that even the most chronic patients have is actually spent as a consumer, someone outside of the healthcare system. And so as a result of portals capturing only information about episodes of care. They're largely inadequate for population health management. There isn't really information there about what they're doing in between those care episodes. Portals are also tied to healthcare systems as opposed to individuals. If you, as a consumer, want to gather information about the care you have received, you have to go to a lot of different places. And if you are a chronic patient with, say, 10 different specialists, you probably have 10 different portals to log into. And this kind of disjointed system, this disjointed model for engagement doesn't really encourage behavior change in any way. It really just kind of captures information at the point of care. And that's not optimal for a coordinated care kind of environment that a lot of organizations are moving toward as a means of providing value-based care and addressing those both regulatory and market pressures. Excuse me. But replacing portals isn't without challenge, and I won't dive into these too much. I think the points kind of speak for themselves. But I think really for a lot of healthcare organizations, the patient portal is a lot like the old hooded sweatshirt that we all have. We know that there are newer, warmer, fuzzier, cozier hooded sweatshirts out on the market. You could probably buy one this afternoon if you wanted to, but we have so many other wardrobe priorities: new shoes, new suits, new dresses, even new undershirts. That the old hooded sweatshirt endures year after year after year because we have so many other things to worry about, so many other priorities that it just doesn't get addressed. But unfortunately for healthcare organizations, and as is the point of this report, that's something that needs to change. The industry is leaning toward a model where engaging with consumers is really just the first step down a road that also encompasses education, activation, and ultimately empowerment. The end goal in a coordinated care environment is to create sort of a milieu where consumers feel like they can change their behavior for the better. They feel like they are advocates for the care that they receive, and they ultimately feel a shared responsibility to live healthier, more productive lives. And getting there, obviously requires some work and some steps in between. Existing technology is able to educate consumers in a language that they can understand to help them see what they need to do, help them learn about the condition that they've just been diagnosed with, or to learn about some of the changes that they need to make. And a few tools can help activate them and address some of the needs they might have for accessing care or other services that they have, and even give them a voice. But getting to the point of empowerment is something that very few solutions on the market are able to achieve today, and many do so outside of the larger healthcare system. And this is a challenge that a lot of organizations are facing and will face as they try to transition toward more coordinated and more value-based care. So this next slide is looking at why this is so difficult, why it's so difficult to empower patients. And if you kind of look from left to right here, you'll see that as consumers move from a point of being healthy to being at risk and so on, the number of engagement tools that work best, the number of members of the care team, and the number of care venues that they visit only increases to the point where someone with a complex chronic condition or an acute condition is going to have all of these touch points that are listed here in this chart. And the phrase we often hear is meeting consumers where they are. And in that case, every single one of these touch points on this chart needs to be addressed by a healthcare organization if they are to provide this broader engagement model for coordinated care. And it's an incredible challenge. And we see a lot of movement in the market on the left side of this chart. There are all kinds of apps for healthy people. There are all kinds of tools. There are all kinds of services that are addressing those needs. And those are certainly important, but those really just kind of scratch the surface at what organizations really need to do if they want to improve engagement across the care continuum and to address these complex patients who are, constituting the bulk of the healthcare costs that they have. And another challenge for implementing this model, is that care teams, as we typically see them, are evolving as well. The traditional care team is at the center of this circle in gray is, typically the physicians, the nurses, the pharmacists, those who are providing clinical care. But in a more coordinated care model, there's also a holistic care team that's addressing some of the less clinical areas of care. We think of diet and nutrition and activity and mental health and some of the needs that arise from physical therapy, such as post-surgery. These are areas that have often gone overlooked in the care continuum, but are increasingly important for organizations that are trying to rein in cost and reduce readmissions and improve quality of life for consumers after they have experienced an episode of care or in treatment for a chronic condition. And then on the periphery, there are a growing number of non-clinical services that occur in the community through faith-based organizations, through groups such as Meals on Wheels or the YMCA, or a host of other entities that consumers can interact with in their community and will interact with far more often than the clinical care team, and even more often than the holistic care team. And what's important to realize about the circle here is that as you move from the center out to the edges, the use of and access to EHR data actually diminishes, while the use, access, and availability of non-EHR data and the use and value of that data increases. So, members of the holistic and community care team, they're looking at social data, community data, demographic, economic information as those areas affect the kind of health and wellness decisions that a consumer might make. And they're not necessarily going to have access to or a need for EHR data that's capturing information from episodes of care. Or to put it very simply, it's highly unlikely that whomever is scheduling Meals on Wheels delivery is using an EHR. So anyone who is looking to improve engagement and make it a very a broad type of program will have to consider, what sort of systems and what sort of touch points these members of the care team have, and far beyond the traditional means of accessing clinical data. And so this model here describes what Chilmark is calling a collaborative health record. This builds on our longitudinal patient record that we've devised and featured in previous reports. And the main addition here is right at the top, and that's the community and social data. To fully understand what is affecting a consumer's health, wellness, and well-being, organizations need to know and understand the social determinants of health that are affecting adversely their ability to make healthy decisions or visit healthcare facilities and access services on a more regular basis. And this is going to be key to making engagement a more collaborative process, more bidirectional than the model that exists today, which is still very transactional and based on needs that a consumer may have at a given time, such as scheduling an appointment or requesting a prescription refill or even sending an email to someone on the care team. Those are important functions, but they're a very, very limited set of what would be required of much more broad and collaborative engagement models. So that obviously begs the question of who's going to be driving the innovation to provide the next generation engagement solutions to achieve this model that I've outlined here. And Chilmark has identified three sort of sets of primary stakeholders and then a number of secondary stakeholders. The primary stakeholders are those who receive care deliver care or pay for care. They're all directly involved in the care process in one way or another. And increasingly, they are incorporating engagement into their business plans. That's especially true of the non-traditional care settings, but it's also true for both provider organizations that are either participating in alternate payment models or starting to provide more integrated care delivery, as well as for payer organizations and also their employer clients who are working with larger populations of members who have increasingly diverse care needs and therefore insurance needs. And they're all beginning to understand and see a value for a more coordinated care, which begets a more interactive engagement process than the sort of transactional way of doing things that I've been referring to. And as for secondary stakeholders, there's a growing body of vendors, and it's not including this list, it's not limited to this list, and none of them are going to, I think, really provide and work alone here. There's a number of different types. These vendors all bring strengths and weaknesses to the table, and will be using that expertise to inform this engagement process and make it, as I said, a bit more interactive. And also to add to this list of EHR, care management, condition management, and patient relationship management, I'd also add employee benefit managers, all kind of taking or trying to take a bit more of a holistic view to the engagement process beyond individual transactions. As these stakeholders do their work, there's going to be a little bit of short-term pain. That's why that's sad. For the next 2 to 3 years, I think will be a bit of a tough time for these stakeholders. The number of entry points into the healthcare system is only going to get bigger, even with industry consolidation. And as a result of that, the number of point solutions that consumers use to access the healthcare system is only going to get bigger. They're going to be a little bit more confused. There's going to be a need to try and connect to these solutions in some way. I think integration is probably the best that we can hope for in that sense. The second key pain point will be return on investment for engagement initiatives. Some of the shared risk models I referred to previously have demonstrated some efficacy, but a number of other engagement efforts it's still too soon to tell. A lot of wellness programs, for example, have a fairly long are long-term investments. They're aiming for the long game, and so trying to decide 1 year out whether a wellness program has worked is really not conducive to making the program work. And a lot of the we just saw the research come out about wearable devices and whether they're able to promote weight loss. And again, that's early results were not terribly promising there, but that's a long game, and that's something where further study is needed, as is so often the case with those reports. Another challenge is that engagement models continue to evolve. Organizations have to ask themselves, are we focusing on consumer loyalty? Are we focusing on care management? Are we focusing on full-fledged value-based care? And as those models are, as organizations are contemplating which of those models fits them, they need to look at solutions that will fit that model, and likewise, developers of those solutions are going to have to modify what they're doing based on what those models look like. And so there's going to be a lot of back and forth and a lot of soul searching among organizations as they try to understand the models that they ultimately decide to use. And the last point is a fairly important one here, where payer organizations and provider organizations tend to have different needs when it comes to engagement. Payers are trying to steer consumers toward low-cost, high-quality services, where providers want to develop this sense of loyalty among their patients through convenience and through well-rounded educational programs and things like that. And these aren't necessarily competing philosophies, but they're also not entirely complementary. And it will it's going to take some time, I think, for both of these types of groups to come together, sit down, and figure out how they can bring these strategies together and provide a more integrated solution for consumer engagement. And when that does happen, the kitten will be happy again. And consumers will reap a lot of long-term gains here. They will have some access to a collaborative health record. It won't be complete. There'll be a lot of information about social determinants that may not make it in there, and devices may not be fully integrated, but they'll have some access to their record, their collaborative health record. The customer experience is only bound to improve. You know, responsive web design will make its way into these types of solutions. And when consumers have access to the information and they're able to see it in this convenient multimodal way, you know, interacting with these solutions, you know, several times a day on a mobile device as opposed to once every few months through a static web portal, they will become more active participants in their own health and wellness and will be more empowered to manage their condition if that's something that they need to do. And so in looking at the market for the next few years, you know, right now and for the next couple of years, we'll be in a sort of a portal of portals kind of state. The primary use case here is viewing and reacting to the information that is there. It will be a step up from, you know, 10 logins for 10 different portals, but it'll still be a system of record, and it'll still be limited mostly to the largest systems, the ones that have a lot of portals that they need to bring together, but also to the largest of payers and employer groups that you know, as noted, are moving forward the fastest on addressing shared risk. Over time, these solutions will evolve a little bit to sort of the first state of patient relationship management and care management. Device data will be integrated in stages. Engagement will be a little bit more bidirectional and as opposed to transaction-based. And some of the smaller healthcare providers and payer and employer organizations will be, you know, on board here. And these types of sort of use cases will grow a little bit toward contribution and transaction on the end of users. We're still sort of a few years out from a point where engagement solutions will be able to provide functionality focused on interaction and even prevention, where a consumer sees you know, their device data, sees other social determinants of health data, coupled with interactions in near real time with members of the care team and the larger care team, not just the clinical care team, to be able to make decisions about their own health and wellness that will, you know, over time be able to have a positive impact on their overall health and well-being. But again, that's something that's going to take some time, and it's going to take quite a bit of collaboration among all the stakeholders mentioned in order to bring that to fruition. So we see sort of three groups of sort of entities that are moving forward toward engagement. We sort of classify them three ways, and this is true of vendors as well as healthcare organizations. The leaders are you know, they're pushing toward value-based care. They're pretty much all in on shared risk. For them, you know, the emphasis is customer loyalty, not so much in a marketing sense, but in a market share sense, where they're trying to demonstrate that they have a broad engagement model, because not just because that drives value-based care, but because that drives a better consumer experience. And they're as a result of that, they're bringing about this level of engagement on a very large scale, and they're doing so in order to boost their already high visibility in a market that, again, despite consolidation, is still very crowded. The followers, you know, their push is more on the side of care management. They're still kind of in the revenue cost model of implementing their coordinated care programs. So their emphasis is a little bit more on the value that engagement can provide rather than sort of the consumer loyalty that they might gain from it. Their scale isn't quite as large because they're, like I said, they're focusing on care management, condition management, and that brings with it a little bit more volatility because those populations can be a little bit more difficult to manage and engage with at times. And finally, there's the waiters, not to be confused with those who bring you food at a restaurant. They're waiting in part because they're operating in a fairly uncertain part of the market. They don't know if the next few years will bring growth for them or the potential for acquisition. And so as a result, for them, engagement is occurring on a smaller scale, and they're doing it in part to emphasize that engagement is part of their strategy and the vision that they have, so that they can either stand out from the pack or, both to grow and to potentially, find a suitor in this kind of volatile dog-eat-dog world that is the modern healthcare industry. So I'll finish with some general kind of conclusions and recommendations. Again, these apply both to healthcare vendors, IT vendors, as well as organizations. And I think that the most important one is that for engagement programs to work, technology, experience, and business model all need to align. As a quick example, you can have the greatest engagement solution and the most progressive, forward-looking, coordinated care model, but if the customer experience is still lacking, if people still have to spend a lot of time waiting for an appointment, if the if your apps if that app is crashing, it's not going to work. Your engagement effort is going to fail. And so all three of those need to be very closely aligned in order to make your engagement effort succeed. And the key ways to do that are to figure out what you're trying to accomplish with your engagement model. As I mentioned before, are you focused on loyalty? Are you focused on driving value through care management? Are you focused on just sort of demonstrating that you can engage with your population? And if once you've defined that value prop, you can start to think about each of those three elements: the technology, the customer experience, and the business model that you're trying to achieve. And then you can find some like-minded collaborators, whether they be alternate venues of healthcare or vendors of IT solutions or other provider organizations or payers in your area, to start to make that engagement model you have a bit more of a reality. The next goal, the next sort of main takeaway is to as I also mentioned, to kind of go beyond some of the convenience and low acuity care episodes that so many engagement efforts are focused on. And the way to do this, the way to push beyond low acuity care and these sort of individual care episodes to more coordinated care, is to incorporate a more consumer-centric design into the engagement solutions that you develop and roll out. Understand how consumers are going to use these tools and make them convenient for the processes, for the goals that they're trying to achieve and for the overall healthcare needs that they have. Make it as simple as you can without taking away from the clinical efficacy. Make it something that's going to stick. Make it something they want to interact with as often as the social media apps on their phone. And if you do that, you're going to start, kind of plant the seed for behavior change. If they're willing to interact with these solutions several times a day, then it'll start to be a little bit more routine for them. And I think the final key takeaway is that, this is going to take time. To turn engagement on its head will take years. Obviously, the market outlook I presented here describes that. Small steps are great. A lot of organizations are still kind of in the pilot phase of programs to improve engagement. They're working with small bits of their cohort population to try and test out some of the new modalities of engagement to see if they work. Can they drive down A1C levels? Can they reduce blood hypertension? Can they increase activity? And these steps are great, but I think at the same time organizations need to look at the big picture. Think about why you're doing these things. It's not just about A1C or blood pressure or the percentage of your population that downloads an app and interacts with it on a regular basis. The ultimate goal here is to help people make better decisions so that they're living healthier lives and don't have to spend a lot of time in high acuity care situations. So that concludes my presentation. I will now open the floor for some questions.
All right, Brian. So we've been having some questions come rolling in, a lot of good ones. So we'll start with this first one from Anna. What assumptions do you have about adoption of a shared record on patient-entered data? Because so far, there's no good evidence that consumers are motivated to do this.
Yeah, a lot of that information is admittedly anecdotal, and it's I think the best evidence of that patients are interested in data comes from open notes. I know that's physician-entered data, I understand, but that shows that there is an interest in sort of establishing this bidirectional view of patient information from the perspective of making it collaborative. In terms of how to make it work on the consumer side of things, I think a lot of that comes down to making it easy for consumers to access their information, upload it, and then at the same time make them know that their care team is going to also use the application as well. So I think in that sense, that might be one of those places where you start with a small cohort group, and particularly one where there's a lot of interaction already between the care team and the patient and his or her caregivers. It could be a condition where there is a lot of that back and forth. I mean, cancer might be one, or other chronic conditions where there's a lot of information to be managed, and it can be of use to both clinician and patient.
So the next question is from Vince, and it is kind of a follow-up to that last one, or related to the last one. It's about the collaborative health record. So CHR is a great concept, but reminds me of the joke about the economist asked how to get off a desert island in the ocean. Assume a boat, he says. So how do we actually get to collaborative health records, and are there any real-life examples yet?
That's a good point. I think the answer for that, it kind of builds a little bit on the previous question. And real-world examples of collaborative health records, admittedly small sample sizes. There are a number of vendors that are building, to use another older term, personal health record solutions that do give consumers control of that information and allow them to dictate who on their care team gets to see that information. Again, those are use cases that are fairly limited in both in scope and I think and in utility, because there's still not a lot of consumers out there that won't necessarily need that service. I think for a potential use case is much like one I mentioned before, where that you have a condition that's going to have a lot of data that's and it's not just sort of nuts and bolts data where you're talking about data from a remote patient monitoring device or from a wearable device, but I think wherever there's a lot of information that needs to go back and forth throughout the treatment process, those are scenarios where a collaborative health record is going to matter a lot. And also to build on sort of some of the social determinants of health, I think in those cases it's going to be a healthcare organization really taking a kind of a bold step or even a few steps forward to understand the community that its consumers are in. Like the example in, I think, Camden, New Jersey is a great example where it's organizations that are using information to understand the community that their consumers are in, and start to identify a lot of those gaps in not just care gaps within the context of a evidence-based care plan, but care gaps in the sense of, well, there's no grocery stores around, or there's no easy transportation to and from healthcare facilities, which is why everyone's going to the hospital. That's definitely a concerted effort to try and build that kind of record and to incorporate a lot of that information.
Okay, great. Next question we have from Hans, and this is from a technology and data perspective. How do you see the development of this engagement process as an EHR vendor-driven initiative or standalone companies designed to do all of this?
I think, at the risk of copping out a little here, I think it will be a bit of a combination. I think the standalone vendors probably have a leg up on developing interfaces and bringing in other information sources. But I think where EHR vendors stand is the connection to the clinical environment. And so I think they will need to work in concert. I can't remember I don't know if I mentioned open APIs in the presentation, and I talked about it a little bit in the report, but I think that's where if EHR vendors that are willing to kind of make it easier to connect to their systems will have a better time succeeding in working with a lot of these standalone vendors in order to build this kind of more collaborative solution for engagement.
And then this one's a quick question, but are there any innovators in this space that you can think of that are really changing the game, and what are they doing to enhance consumer engagement?
That is a good question. I talked to a lot of different types of vendors here, and so I think the answers will be a little scattered. One company that stands out or that stood out was Wellframe in the way that it takes a very mobile first approach engagement, even down to using the built-in pedometer in today's smartphones versus giving people wearable devices through activity tracking programs based on the presumption that we're reducing a friction point. For other kind of engagement solutions, I mean, some of the work that companies like Omada Health and Canary Health have done with comprehensive programs. I don't even know if it's care management so much as it's almost like sort of consumer and patient management, where they're putting together programs to help chronic patients understand the condition they have and learn to sort of live with it in a fairly step-by-step way. It's not throwing a lot of info at people at once, but really making it this sort of incremental thing. Okay, we have a 16-week program. We're going to get step by step about increasing activity, eating healthy, how to measure your A1C, things like that. And I think that those types of approaches, particularly for condition management, addressing some of those, long-term chronic acute patients or the at-risk consumers, is an effective way of doing things in a very kind of collaborative, but also way that also makes it fairly accessible and literate in a way for consumers.
Okay, so the next question is the primary care physician in the best position to coordinate care for the patient. This is versus the hospital versus the payer. E.g., who should own the shared patient portal? Who should be responsible for that? Because you have stakeholders coming in with their own patient portals. So who's really the best stakeholder to be delivering that service?
That is a very interesting and complicated question. But I think, if you're looking at it from the perspective of sort of more chronic patients, I think it's really beneficial for whatever institution or affiliation the care coordinator would have, just as that person is typically kind of the leader of the care team, that person or the team, support team around that nurse care coordinator would be ideal for administering or sort of overseeing who is using this shared engagement solution. In a perfect world, I think consumers would have that, but I don't think that's any time coming now. But from a care management coordination perspective, I think a nurse care coordinator or someone in a similar position is probably best suited for that role.
Okay. The next question is about just patient engagement in general and the business model for it. So most patient engagement solutions, a lot of them are preventative, and there is most actuarial related aspects of healthcare are definitely more short-term than that. So where is the current business model really coming from, or the business case coming from, to bother with patient engagement solutions if a lot of the benefit from it is going to be pushed out into the future, where the current people paying for the healthcare aren't going to be seeing the benefit?
I think that could probably be an entire new report in and of itself. But I think for organizations, a lot of it stems from, as you said, that engagement is very preventative and it's preventive, and a lot of it's looking at very kind of short-term solutions. And there will certainly be demand for that. I mentioned some of the low acuity services. I think for a lot of them, telehealth is a big example, and retail health and urgent care also, I think, fit into that model. And they're all focusing on engagement within their business models, because they know that that'll help bring in some of the additional consumers in the short term. But I think the long term selling point for this is, as I said, is difficult to determine. But I think where the benefits will start to come out will be in a slight sort of bending of the cost curve. The costs are always going to continue to go up. That's pretty, I think, basic economics. But the ability to start to drive down overall costs, I think, will sort of be the selling point in the long term. I noted some of the leaders focusing on engagement as it fits into value-based care versus just sort of dollar and cents care management. Better engagement will bring about and improve quality, and it'll improve the way that consumers perceive institutions. It will improve the ratings that they receive, and that will start to impact the bottom line in a positive way. And I think the way to look at it isn't so much as cutting costs. It's not just about cutting costs, but it's the way to look at it is how to drive revenue, how to bring in additional members, additional patients, additional consumers, and how do you appeal to them and provide services that they are going to want to use. And you can start with some of that low acuity stuff that will bring in people when they're young, but you also have to build upon that to get to start to address them when in fact they are older and may be more likely to need those services. And so I think that the long game is a focus, I think, on creating value and creating revenue instead of just cutting costs.
Most reports have focused on the negative aspects of polls, what hasn't been working, what's been failing, and taking learnings from failings. Are there any success stories that you can share around specific features or technologies that have worked that the industry can learn from their successes instead of from general failures?
Well, some of these, I mentioned a few successes a few minutes earlier, and some of the models that did work. One that stood out to me was the YMCA's diabetes prevention program, which is now kind of being rolled out as a model for larger diabetes prevention measures. And what stands out there is that it actually, and this is also something I often think about when asked about engagement in general, is that it's not it's not crazy newfangled stuff. A lot of it, you know, in the diabetes prevention program is a mix of high tech and also high touch intervention. You know, I've heard them presentations about it, and they'll say, oh, we can have meetings anywhere where there's, you know, chairs and a place for me to plug in my laptop for the program leader. And in situations like that, you know, digitizing stuff, you know, those kinds of interactions, building a community of consumers with a similar condition is not difficult, and a lot of those types of communities exist already. But you know, just again, I think it's focusing on incremental improvement and finding ways to, you know, and using that as a way to keep people engaged, and also bringing groups together, you know, to kind of help them understand that they're not alone on their road to trying to make healthier decisions or manage the condition that they have.
Okay, so how might large consumer technology companies with substantial expertise in consumer engagement from other industries enter healthcare and spur new models of health engagement?
That is something I did touch upon a little bit. You know, a lot of those firms and you know, the ones who make you know, consumer wearable devices or smartphones for that matter, have tremendous experience in getting consumers to buy into sort of their product, and I think that's an advantage they have. And I think the way that they will be able to you know, teach healthcare a thing or two, as it were, is to demonstrate their ability to appeal to consumers, to work with consumers, and to show those entities that it is really about kind of building a base first, and then kind of bringing technology to that population. You know, I think a lot of healthcare organizations have been trying to throw a lot of technology at consumers, and I think even some of the previous efforts by consumer technology vendors to enter the healthcare space has focused largely on technology as opposed to you know, ease of use and design. And that's, I think, really where these firms, you know, current firms that are starting to make forays into healthcare will have a leg up, is their ability to, you know, design solutions that people actually want to use. And the challenge and the opportunity for them as well is to work with established healthcare organizations, reputation for clinical efficacy in whatever specialty or, you know, broad field that they cover, to work together and kind of almost present a united front to consumers and say, this vendor plus this healthcare organization equals the healthcare consumer experience that you want.
Okay, so this will be the final question. How do we rationalize our market outlook?
All right, I'm going to go back to that slide. I think one of the time frame for this on here a lot is dependent on where things are happening now, in the sense that there are a lot of point solutions that will address individual or, you know, 2 or 3 different core functionalities of the broader engagement model. The report itself lists, you know, a number of different features that these solutions will have. They range from, you know, accessibility of open notes for physicians to, you know, calling up a video chat with a physician within the solution itself, to you know, access to educational material that is tailored to your condition or your diagnosis. And a lot of point solutions currently address some of that functionality, but none really sort of address the all-in-one type of solution that engagement will truly need. So the market outlook is based on the time frame we think it will take for these point solutions to start to become integrated with each other, you know, whether it's through the use of open APIs or through the use of, or through technology firms acquiring each other to go beyond these sort of individual point solutions that will accomplish, one or two or even a handful of these, required pieces of functionality that we see for a broader engagement model, to start to come to fruition in a solution that's addressing several of those needs, or a majority of them, so that consumers increasingly have a single point of contact for their healthcare needs versus a disparate number. And as we've said, we think that that's going to take some time, both from the standpoint of technology, but also from politics, of getting the systems as applications to work together and start to complement each other.
All right. Well, thank you for joining us, everyone. We are now nearing 2 o'clock. It's been about an hour, and we will be sharing the slides as well as the recording from this webinar via email after this. You can also look for it on Twitter and LinkedIn, where we'll be sharing it as well. Thank you for joining us, and we look forward to seeing everyone at the next webinar, we hope.
Thanks, everybody.